What exactly is the G-spot? It's real! Everything you need to know about female sexual anatomy. What is the G-spot? The G-spot, short for Grafenberg spot, is a specific area inside the vagina that some people believe is especially sensitive. It is named after Dr. Ernst Grafenberg, who first described it in the 1950s. This area is thought to be capable of producing pleasurable sensations when stimulated, but experiences can vary widely among individuals. Please subscribe, comment, and share this video to support our channel. Where is the G-spot located? The G-spot is generally located on the anterior, front wall of the vagina. Approximately 1 to 3 inches, 2.5 to 7.5 centimeters inside. It is often described as having a different texture compared to the surrounding vaginal tissue. Sometimes feeling slightly spongy or ridged. Is the G-spot real? Yes, the G-spot is real, but it is important to note that its presence and sensitivity can vary. While some people find this area highly sensitive and pleasurable, others may not experience the same sensations. The scientific consensus acknowledges the G-spot as part of the complex anatomy of the vagina, though its characteristics and the responses it elicits can differ greatly among individuals. How can you stimulate the G-spot? First, manual stimulation. Using a finger or fingers, gently press or massage the anterior wall of the vagina with a come-hither motion. Second, sex toys. Some sex toys are designed to target the G-spot with specific shapes and angles to apply pressure to this area. Third, sexual positions. Certain positions, such as lying on the back with legs elevated or being on hands and knees, may make it easier to access the G-spot. Frequently asked questions. 1. Is G-spot stimulation necessary for orgasm? No, not everyone requires G-spot stimulation to achieve orgasm. Many people find pleasure and reach orgasm through clitoral stimulation, vaginal penetration, or a combination of both. 2. Can everyone find their G-spot? Not everyone finds their G-spot or finds it particularly pleasurable. Sensitivity can vary, and not all individuals may experience significant pleasure from G-spot stimulation. 3. How do I know if I'm stimulating the G-spot? The G-spot may feel different from surrounding tissue, often described as spongy or textured. Some people experience a pleasurable sensation or increased arousal with stimulation of this area, but responses can differ. 4. Does G-spot stimulation increase sexual pleasure? For some individuals, G-spot stimulation can enhance pleasure and contribute to more intense orgasms. However, it is not universally the case, and preferences for stimulation vary from person to person. 5. Can the G-spot be enlarged or changed with practice? The G-spot itself does not enlarge or change, but the sexual arousal and sensitivity of the area can be enhanced through practice and exploration. Understanding one's own body and preferences can improve sexual experiences. 6. Are there any health concerns related to G-spot stimulation? Generally, G-spot stimulation is safe. It is important to use lubrication if needed, maintain good hygiene, and listen to your body. If any discomfort or pain occurs, it is advisable to stop and consult a healthcare provider if necessary. 7. How does the G-spot relate to other parts of female sexual anatomy? The G-spot is one part of a complex sexual anatomy that includes the clitoris, vulva, and vagina. Many people experience pleasure through a combination of clitoral and vaginal stimulation. Understanding how different areas interact can help enhance overall sexual satisfaction. In summary, the G-spot is a part of the female sexual anatomy that can vary in its characteristics and sensitivity. Understanding its location and how it might interact with other forms of stimulation can be part of exploring one's own body and sexual health.